What I like about orthopedics is that it's a hands-on specialty. You see patients that have a defined problem that oftentimes we're able to fix. And it's the fixing of the problem that really makes it worthwhile for me. I'm Dr. Mark Lesh. I'm an orthopedic surgeon here at Adena. So I was in Pittsburgh, initially in private practice, and then subsequently became an employed physician, but was really in the same practice for 22 years before coming here. I interviewed at several locations in Columbus, and Adena was clearly my first choice because of all that's happening in orthopedics here. So I do a lot of shoulder arthroscopy, rotator cuff repairs, shoulder dislocation surgery. I also do knee arthroscopy, so you'll hear meniscal tears, ACL tears, cartilage injury, and then from a joint replacement, obviously I do partial knee replacements. I do use a robot for that, and I do total knee replacements as well as some total hip replacements. Sports medicine is not just for the young nowadays. I mean, everybody is active. We want everybody to continue to be active as they get older. So we will treat high school athletes, college athletes, and also adults that want to continue a high level of activity. My philosophy of care is really centered about the patient. A patient will never come into my office and I'll tell them that they have to have an operation. I mean, it's not how it works. I basically will get the patient involved. I'll give them the options. I'll explain the risks and benefits of the various options, but I really expect them to be a very active participant in the decision-making process. And my job is to sort of educate, give them the options, and then together we make a plan. So away from work, I have 3 children, and they're very active. I have a son involved in volleyball and golf. I have a daughter involved in field hockey and theater. I have another daughter involved in golf and swimming. So that takes up a fair amount of time. This area reminds me a lot of the area in Pennsylvania that I grew up in. I feel very comfortable in this environment, and it is nice to be able to provide care outside the city. When I was in Pittsburgh, I was very much part of the city, and so down here it's nice to have a center that has everything that you could pretty much have at the city in a rural setting close to home for the patients.